Capenergy launches the first intercavitary Tecartherapy equipment with a medical CE certificate for the treatment of pelvic floor and urogynecological pathologies. The great importance of this invention is the fact that it is the first certified device that fills the current gap between conservative surgery and therapeutic exercises such as Kegel or hypopressives. Until now, there was no clear technological solution that offered an effective therapeutic response to diseases such as urinary incontinence, chronic pelvic pain, and numerous other disorders that affect both men and women. Thanks to this innovative option, the patient has a treatment element scientifically endorsed and certified by the health authorities to effectively treat their pathologies. Let's see how it does it. First of all, it is important to know that this device uses a very specific therapeutic target and that it has proven to be the most effective at the moment. This is the generation of collagen. Collagen is a protein that forms the matrix and is the natural support of the pelvic floor. Although it is an intrinsic component of the body, its production declines over the years. This causes the muscles to suffer a progressive sagging that can cause problems such as incontinence, prolapses, pain, or even infunctionality of some structures. Getting the tension back to the pelvic floor muscles and revitalizing them is essential to reverse this process. Collagen, in this case, is produced by a double action. First, by the increase in temperature. When the tissue is subjected to an endogenous thermal increase of between 40 and 42 degrees Celsius in a sustained manner for several minutes, the restructuring of the defective collagen and the proliferation of the new collagen is activated. This fact contributes to provide the muscle fiber with greater tension. 2. The second procedure to generate collagen is pressure. Given a certain pressure, the structures react and the production of collagen intensifies. Well, now Capenergy has combined these two therapeutic targets into a single device on the market that allows maximum therapeutic intensity and efficacy to be achieved. This is how the C500 urogynecological intercavitary Tecartherapy device was born. The C500 Urogyne device is a certified medical device that is indicated for urological and gynecological indications. The most important indications are urinary incontinence, stress and mixed chronic pelvic pain, obstetric trauma, scars derived from surgeries and episiotomies, prolapses, fecal incontinence, and the most common coloproctological disorders, urogenitary syndrome of menopause, vaginal atrophy, and erectile dysfunction in the male. This device has an innovative hand probe that receives the name of the pelvic floor professional who inspired it, the specialist in pelvic-perineology, Marta Jerez Sainz. MJS hand probe. This hand probe is unique because it is designed in the image and likeness of a finger, and this allows it to be the natural extension of the professional's hand. Thanks to this sensitive touch of the cavity to be treated, the professional can work through his manual therapy the painful trigger points and accelerate the disappearance of pain. Secondly, the device has a built-in temperature sensor that allows the internal conditions of the patient to be evaluated at all times during treatment to ensure that the target temperature is reached through the device. This characteristic is very important because not only quality therapeutic results are achieved, but it also allows treatment in total safety conditions for the patient. No risks of discomfort or burns. The rate of effectiveness in the treatment of pain is extraordinarily high. Already from the first session, between 70 to 90% of treated patients say they reduced their pain by 75%. As the studies carried out by recognized hospitals and researchers reveal, the results leave no doubt that there is a before and after in the technology with the invention of this device. The results obtained with the C500 Urogyne equipment have proven to be 75% more effective than single-patient resistive intercavitary Tecartherapy devices. This technology finally offers quality results in short time periods. In addition to the quality of care, the C500 Urogyne stands out for being painless, having no negative side effects, and for being an operational and profitable working instrument for the professional. Thanks to its use with disposable covers, the treatment is economical for the patient, who should not acquire her own probe, but only use a protective and hygienic membrane that is opened in her presence. This guarantees the hygiene of the treatment and prevents any type of infection. In short, the Capenergy urogynecological Tecartherapy device fills the gap that currently existed in the treatment of the pelvic floor and numerous urological and gynecological pathologies. Until now, we could only opt for a surgical intervention or to perform physiotherapy exercises when we were diagnosed with a loss of urine or a pelvic pain problem. Thanks to this important technological innovation, a quality result can be obtained, scientifically endorsed and certified by the health authorities, through a simple, safe, hygienic, efficient and economical procedure for both the operator and the patient. Many professionals have already contrasted it, and thousands of patients have benefited.